So we get a lot of questions like what type of acne is out there. Most people categorize acne as either adult acne or teen. So when clients come in to see myself as a professional, I look at a lot of different things on their skin. Like I look at, is it inflamed? Is it angry? Does it need a dermatologist? Or is it just blackheads, whiteheads, maybe just some congestion that some simple skincare and extraction facials can take care of? Whiteheads and blackheads are pretty simple to remove. If you just come out of the shower, the skin is warm, and you just extract, making sure that you have either Q-tips or tissue on the fingers, and in a gentle lifting motion on the skin so you're not bruising the skin or damaging the skin. That's when you get some of the scarring. Some people think that scarring is post-inflammatory hyperpigmentation, which is where it looks a little bit darker. That's just pigment on the skin that actually can be lightened. Scarring actually is a deep little kind of caved in area on the skin, and most of the time that can be taken care of with a few different things. Lasers do really well on the acne scarring, causing a irritation. The irritation then heals, the collagen then boosts, and it kind of pops up a pock mark or a scar on the skin. We talked a little bit about using tissue on the finger or using cotton and gauze, lifting it up. What acne you do not want to extract is pustules, pimples, or cysts. Those are very dangerous for you to be playing with, and they can also spread the acne and scar the skin. So it's very important that you then let a professional like myself or esthetician, dermatologist take care of it. Adult versus a teenager. The worst thing in the world that you could do is if you have adult acne, like a blemish here on the chin, on the forehead. I mean, it happens to myself, it happens to women in their 30s, 40s, and you'll automatically think you're having acne. But the one or two blemishes that actually are popping up are more hormonally driven, and you just have to learn how to work with those and diffuse those when they start coming up. So as an esthetician, we teach those techniques to our clients, patients, on how to handle the skin when it erupts. The worst thing you can do with adult acne is actually turn around and treat your whole skin like you're oily. You're going to end up drying your skin out. You're going to end up with more acne problems all over the skin. So you just gently want to treat the one area that's breaking out, or the two areas that's breaking out, or the general vicinity of what's breaking out. And like teenage boys or girls that are athletic, they're doing a lot of sports, and they have a lot of breakout. Whiteheads, blackheads, a lot of time they just need exfoliation because the skin is becoming very dehydrated through all of that exercise and through the sweating and the perspiration that's happening. So we'll do some extraction facials on those type of skins. We'll teach them how to do exfoliation at home, which is, instead of manually, it's actually using a product that actually eats that dead skin cell off and allows that oil to come out and be washed off rather than kind of back up and clog in the skin. So extraction facials are very important. The worst thing that you can do as a teen is go in and get a facial, what's called a European facial, or a facial where they use a lot of steam or massage, because that will only add to the problem that you're having. So balance is very important in the skin when you're having an adolescent kind of reaction or acne lesions happening. Cystic, of course, or angry, one or two is okay. We can still kind of treat that with general skincare, which we'll talk about, but any more than that, where it becomes very deforming to the face, then we'll advise for the client to go see the doctor and get maybe a prescription to help internally, as well as doing the topicals that we're telling them to do.